And so I need a few notes just to remind me, but thank you so much. It is truly great to be back here. And now you also know how old I am because I told you I was here 25 years. So very, very proud. I actually came here July of '92. Right? Pretty amazing time, and my husband and I are so blessed to be here. We love it. This is where we're retiring too, so I'm not doing that anytime soon though. Still have lots to do. But I did want to tell you, Barbara asked if I could tell you a little bit about, so I do tend to talk fast, so if I go too fast or you want to ask questions along the way, please do. But I thought I would just tell you a couple of the little tidbits about what's going on at the hospital since I haven't been here in a while. We are very mindful in our industry, healthcare industry, that you hear about healthcare and healthcare debates all the time, every day on the news. I'm not here to talk about any of that. In the state of Maryland, I will just do a little caveat, whatever goes on in Washington, D.C., state of Maryland has a slightly different take on the hospital industry. We have a unique system. You've likely heard us talk about that historically. Our reimbursement system is so different. We're on a new demonstration project, which will be made more complicated depending on how Washington, D.C. decides on things. And it's going to be made more complicated in 2 years when we go into the second phase of the new focus of this project. But in the state of Maryland, the intent of the program is actually to improve patients' health and reduce costs, especially to reduce costs, by adopting sort of a new focus on what is the total cost of care per Medicare beneficiary. That's sort of the major focus. The total cost of care is well beyond the hospital walls, and so it makes our lives much more complicated in terms of how to work with everybody else and to manage costs in the right setting, the most appropriate setting for the best quality, first and foremost, but then the best cost for the society. So it's a very complex system. Larry Shattuck used to be on our board, and he used to talk about the complex systems engineering that he loves. I'm reminded constantly that that's truly what healthcare is about, and it's very complicated business. So when all of that starts going on, I am truly grateful to just come home and focus on my hospitals and seeing how we can just make a difference today and maybe tomorrow. And if I could plan a year out, that would be good. Beyond that, we'll see how all the powers that be figure things out. So it's also truly, at this critical time, phenomenal that we are part of a very large system, a very large nonprofit system, which is still very important to me on a personal level. That $5.5 billion system. But the focus is how do we have a little bit of money left over at the end of the year so we can reinvest in our communities, and that's MedStar's focus. So I'm very proud of that part. So what's going on at the hospital, and what are we working on? So we truly are focused on how else can we improve access to quality care at affordable prices. One of the next major events that we hope to be announcing coming soon is the opening of East Run. The East Run Center, working with Cherry Cove, bringing a community, an expanded psych practice of psychiatric health, and also primary care in East Run, right across the street from Great Mills High School. So we are excited about that. Don't have a date for you, but coming soon. We will be relocating there. So we are continuing to recruit physicians, because that was one of the major aspects that we wanted to pursue when we joined MedStar, is how else can we continue to develop and evolve our services here. So we are always looking at the right, what we call hospitalists these days, adult and pediatric hospitalists. Those are people who are always in-house. and really focus on acute care medicine. So we're always recruiting for those folks. But outside of that, we're also focused on trying to find more urology coverage for this county, because God bless Dr. J. He would like to retire someday, and we won't let him. So actively focused on finding him coverage, but also then growing the practice in urology. Focus on that, focus on neurology. Neurology is fascinating. We have, by the ratios, enough neurologists in the county. It's just they practice outpatient, and we need coverage inside the hospital. And so we are really looking to see how else we can expand the neurology coverage for the hospital. Really critical on in several areas, especially any movement disorders or other things that start to evolve for patients as we age, and of course stroke. So pretty critical. We are blessed that we have 24/7 coverage for neurology as it relates to stroke care, and that's because of our MedStar health connections with Georgetown and the Washington Hospital Center. So we're set in terms of the emergent issues, but it would be great to have the consultation coverage. We are looking at 1 or 2 more orthopedic surgeons to join our MedStar practice. We are looking at other things. The conversations or the specialties I've just referenced actually are actively in play. There are other folks or other specialties on our list that I don't have good candidates for yet, but we're looking for GI and we're looking for obstetrics, and I mean there's several things that our county still needs. The other, we keep an eye on the average age of our medical staff. It's a little bit of an indicator. We had gotten up to like 48 and 49, and that's actually older than you want it to be. You want it to be in the low 40s, so because that is sort of a better mix. We do have over 400 physicians on staff, and we're down to about 42 or 43, so that's good. A lot of progress on recruiting some new physicians into our community, but we still have needs, and would still be considered a healthcare shortage area for many physicians. So that's a little bit in the physician world. One of the, a couple other points on physicians. One of the most recent successful recruits is Dr. Topazaglo. Dr. Topazaglo is he's a general surgeon, but he's a bariatric surgeon and has actually just started doing bariatric surgery here. That's something that we wouldn't have done before. You need to make sure you have a whole host of services to support patients who are going to do bariatric surgery. Obviously, dietitians are pretty critical, counseling aspects, support groups. We've had the support group for folks who would go up to the Washington Hospital Center for procedures, but now we can bring that work here. We will still not do the highly complex bariatric surgeries, but great that we've been able to start this, because that was a bit of a trek for folks to have to go to the city for bariatric surgery. So if you haven't met him yet, he's great. He came to our gala. We were very excited to have him, he and his wife, and he's really settling in beautifully. So we're excited to share that with you. Also, I don't know if you've had Dr. LaPenta come talk to you, so sometime if you want to learn more about palliative care, he might be an interesting conversation to have one day. Dr. LaPenta has just really hit the ground running. If you don't know about palliative care is all about how do you cope and manage chronic disease in a more successful way so that you can live your life knowing you have these chronic diseases. It's not about the dying process. It is about living with these chronic diseases. They might be cancer, but they might be COPD or asthma or something like that. So he often will then dovetail also with our hospice services. But he's just terrific, and he actually is very engaging. So hopefully you'll meet him one of these days. But he's been here about a year now, I guess. And that's really a national trend too. One of the ways to help reduce cost is to try and help manage patients in the outpatient setting, but you have to really give people the confidence that they can be successful in managing their care outside. So he's one of those sort of important resources we have now. So we also have an Ask a Doc educational program coming up, actually Tuesday, January 23rd. I'm putting in a plug at Leonardtown High School. This one, it's from 6:30 to 8 p.m., is actually about protecting student athletes. This is where, again, it's really terrific that we're accessing part of our system resources, MedStar Health Sports Medicine. We actually works with 55 school programs, athletic programs across the state and the region. And I'll tell you the most famous ones. It's the Ravens, the Orioles, the Capitals, and the Wizards. Sorry, I go back to the other name they had. Sorry. In any event, to really this program is really focused on related to the sports industry, injuries. Sorry. So January 23rd at Leonardtown High. Happy to have folks at 6:30. So I think that's the news on the doctor front for you. One of the other things, Barbara mentioned this, and I will say it is actually because we live in this community and part of our the makeup of our board of directors, we've been very progressive in our electronic medical record journey. I've probably said this before here, but when we went live with our fully integrated electronic medical record in July 2008, we were part of 1.6% of all hospitals in the country who had such an advanced electronic record. Today, we are still one of the most advanced, and actually we're just recognized by the Joint Commission for, it's tied into the electronic record, but it is what the government regulations are looking for when you hear the term meaningful use. We, in a meaningful way, use our electronic system to keep patients safe. And we automatically report our data to the powers that be so they can watch over us and monitor our performance. And actually, we've been very innovative in our e-solutions and our submissions on all of this. So the Joint Commission is the accrediting body for hospitals, and they actually were a 2017 pioneer in quality solution contributor. So we were very excited about that. So from the modern age to the 1912, I hope sometime when you're just visiting for fun, or you're here for a Rotary meeting, not that you have to be at the hospital for other reasons, but I hope you can stop by. We have a room now called Reflections, and if you didn't get a chance to see it, it's a pretty terrific little room right outside the cafeteria. And it is all about our history. We're very proud. We're 105 years old this year, and when we celebrated our 100th anniversary, we began this little journey to put the museum pieces together. We actually did consult the town and the Historical Society on how to best present our material, but we didn't want it to get lost because it fits the character of our county, but it's also important to remember how far we've come and who really helped make the right decisions to bring us here. And most notably, it is absolutely about this community, because it is the community that kept us going all along. So it's a pretty remarkable community, pretty remarkable relationship that this hospital's had. Not every hospital is so blessed. So beyond that, more about the other community connections. We are absolutely blessed. We had a phenomenal gala this year. If you didn't get to come, we missed you. Please don't ever think because you didn't get an invitation in the mail you're not welcome. Everyone's welcome. We're always looking for names to put on the list. We would love to have you come join us. It's absolutely everybody is welcome. Okay, so I'm going to get in trouble because I'm going to tell you a number that probably won't be exactly accurate. I know I'm pretty positive it's over $150,000 that we raised, and that goes to scholarships and sometimes to do other projects like the atrium. But we actually think, yeah, my notes say it's $165,000. So I don't want to hedge my bets. It's some number close to that. But we're very excited. We've helped over 140 students with scholarships along the way. So that has truly helped our staffing challenges. We absolutely believe in growing our own here, and are very proud to help support folks on their journey, their education journey, and their career paths. So. I think that's probably what I would want to tell you. We have a phenomenal auxiliary that does a great job with the golf outing, and they raised quite a bit of money as well for some medical equipment. And we are very excited and proud to have $5,000 from all of you to help us with our atrium project. It is kind of interesting when you think about how this county has changed since 1991, but that's the last time we expanded the seating for our cafeteria for our community and for our staff to eat in. 1991, so a long time ago, and the county has kind of grown since then. So we're very excited to basically almost double, I think, the size of the seating. The sad news is we lose the courtyard. So we loved that courtyard and saved that tree for as long as we could, but we really did need to have some more seats. Our medical staff has grown, and that's actually where they meet when they gather together every quarter. So that's the latest news. I can't think of anything else. I'm happy to tell you whatever else you would like.
Some questions?